right, welcome everybody. This is Bridging the Gap on in person instead of on Zoom. So a lot of us know each other like this, and a lot of us are now getting to know that we have full bodies. Yay! So here we go. I'm Celeste, and welcome. We're videotaping today because we want to be able to let those, well, I do get a bad time from those that are out of state and out of the area saying, well, we want to know what goes on in there too. Because people like Dr. Stephey have things going on in their offices at 9 o'clock on Tuesday. So 10 o'clock on Saturday, we get to have him come in and talk with us. And so this will be a really exciting day because every time we go to his office, which is in Covina, California, we learn stuff that we go, why didn't we know this 6 months ago, 6 years ago, 26 years ago, when we actually had the thing happen to us, whether it was a stroke, a concussion, or whatever, because we could have used this information, so we've got it now. That's the important thing. Whenever you get that information, don't feel bad about how long it's been. Appreciate the fact that we're here now and going to have a chance to have this discussion with him. So hang on to your questions. He's going to talk to us for a little bit, give us some information. We'll let that settle in a little bit, and then we'll formulate some questions for him, okay? All right, so welcome everybody. Glad we've got you all back in the room together. Yay. Okay, so here we go. It's all yours.
Thank you. And I'm glad to be here live in person again. It's been several years.
Yeah.
So the first thing, the little piece of paper I handed out to you, I'll get around to talking about that in a few more minutes. But I do want to tell you that in order for you to figure this out, you might need to turn it in any other orientation. But we'll circle back in a bit. The purpose of that piece of paper is to look at a concept called pattern recognition. Pattern recognition. And arguably, if you've never seen something before, frequently you won't see it if you don't have the pattern already somewhere in your mind to organize what it is that you're looking at to have it make sense. But the main point that I want to make of those that have had a TBI, I would suggest that the way to think about this pattern recognition disruption or dysfunction could be similar to taking let's say that I had a picture that I had transposed onto a piece of glass. Okay, all good. But if you've had a brain injury, it would be somewhat similar to me shattering that glass and then trying to put all the pieces back together. And then you think, man, it doesn't make sense. It doesn't make sense. That is a true story. But what I really want to start off, though, is to introduce you to the idea that there's 3 circles of vision that we should be talking about, not the 2 that you commonly know. And sadly, where most eye doctors practice. So in the 2-circle model, 1 circle is, do you need glasses or not to get to 20/20? Right? Everybody thinks seeing 20/20 is a holy grail of going to the eye doctor. I'm going to introduce to you today that that is not the case. In fact, it's probably 5th, 6th, 7th, 8th on the list, maybe further down. The 2nd circle is whether or not your eyes are healthy. Do you have glaucoma? Do you have cataracts? Do you have diabetic retinopathy? Do you have pink eye? Do you have dry eye? Right? Things that are more related to health of the eyes. And I'm sad to say that most of my colleagues limit themselves to the 2-circle model. And I want you to appreciate that there's a 3rd circle in this Venn diagram. And in that 3rd circle, and I'm just going to rattle a bunch of stuff off, much of that you won't even know what the heck I'm talking about yet. And it won't even be a comprehensive list of things that I'm going to rattle off. But there's eye teaming, eye focusing, eye tracking, motion processing, working memory, visual aliasing, beat competency, integrated reflexes or lack thereof, visual auditory integration, visual motor integration, visual spatial skills, visual vestibular skills, visual proprioceptive skills, working memory, if I didn't say that already. And then in some cases, there's just reading, writing, and doing math that has a heavy vision overlay in that third circle. Then I came across an expression a few weeks ago that I thought was really telling, and it's apropos for this group today. And it says, it's not difficult to not diagnose a condition if you don't test for it. Let me say that again. It's not uncommon to not diagnose someone with a condition if you don't test for it. So if you're seeing an eye doctor who's stuck in the two-circle model, they're not going to diagnose you with most of what's going on. Even when you specifically have complaints tied to the third circle, if you don't do testing in the third circle, you can't diagnose a condition if you're not testing for it. I'm telling you, this is commonplace. And I'll give you one quick example. And since you happen to be within arm's reach of me, I'm going to ask you to look straight across the room. Straight across the room. And then I'm going to put this up between your two eyes, go straight across the room. And then stop looking straight across the room and try to look at the very bottom tip of this handle I've got in front of you. Look right at the tip of it now. Yes. And what you didn't know, and I'm going to video this and show it to you because it's a good talking point. Look across the room again. Don't look until I ask. Look at the bottom tip of my stick. Look right at the bottom tip of it. Okay. And not comfortable. No. It didn't make you feel kind of dizzy? Okay. Here's what I want you to notice this time. Can I borrow your pen for a second? Because I want a thinner tip. So this time I want you to take your left hand and cover your left eye. And it's going to be blurry, but look at the tip of my pen now. It doesn't hurt the same way, does it?
More doable.
Yeah. Cover your right eye and look with your left eye. More doable.
Yeah.
Well, what the heck is that all about? Before I tell you that, there is something called the mirror neurons. Anybody read anything about mirror neurons? Okay. So when you watch me do this, the mirror neurons in your own brain that would physically do the same thing, they're doing a mental rehearsal. They just haven't connected it, though, to your fingertips yet. Those are mirror neurons. So what I'm curious to know in your own case is that I'm going to come and face you. I'm going to put the pen between my own two eyes. And I want to know if you feel a watered-down version of the discomfort you felt when you watch me do it. So if you watch my eyes, look at the pen, does that in any way start to feel uncomfortable to you to watch my eyes do this? A little bit. Those are mirror neurons at work. Well, I am going to walk around the room for a quick second. So when you watch my two eyes, I'll go up here. When I look at the pen, both of my eyes turn in. Right? When I look at the pen, first when I look over there, their eyes are straight. When I look at the pen, they cross. My eyes are straight. They cross to the pen. My eyes are straight. They cross to the pen. I'll come. You'll be my target. My eyes are straight. They cross to the pen. I'll look at you. My eyes are straight. And they cross to the pen.
Yeah.
So if my brain says, oh, hang on. Watch this. I'm going to close my left eye. No, I'm going to close my left eye, not my right eye. And when I look at the pen now, does it feel better than when you watch me do it with both eyes? Yeah, it's a little better. Because when I close one eye and the eye that's remaining open looks in, those are different mirror neurons at work. Because when one eye's covered, your brain only has to turn one eye in at a time, not both of them. And think about this. If my brain says to itself, right, if I put the pin here, and my brain says to itself, let's look at the pin, both eyes should turn in and look at the pin. Yours did not, by the way. Your left eye drifted off to the side. And it felt uncomfortable because it was. I realized on my way over that there were some props I left at home or at the office, which feels like home. But picture a clothespin, and that it would take very little effort to pull the clips together on the one end of the clothespin because the little looped wire is really thin. Now, think about the grip strengthening exercises, like the black handle ones that look like an upside down V. Well, now, if you can imagine that grip strengthener was going to take my brain this much effort to pull my eyes together, that I couldn't do it. Or I could, but it would hurt. So in this simple discussion, one of about 15 things in Circle 3, think about what we've learned already. Because then the question becomes, does the brain, can it cross the two eyes quickly, accurately, effortlessly, and sustainably? Or is it inaccurate? Is it effortful? Is it fatiguing? And is it painful? And unlike prey animals, like horses that have eyes on either side of their head, we have eyes closely spaced on our face. We are hardwired to use our two eyes together if we can. So in most circumstances, our brain will compulsively try to use our two eyes together because we're supposed to use our two eyes together. But in this discussion, it frequently results in, I'm so tired I can't see straight. That's a binocular vision problem. And if you're reading, you'll get sleepy, tired, bored, lose your place, skip over words or lines, and can't remember what you read. Or it can affect driving, or balance, or gait, or posture. And if in that regard, if the brain has a tremendous amount of difficulty literally putting one foot in front of the other, some of you are old enough to remember Laugh-In, many of you will not. But there was a character on Laugh-In that was an old man that used to walk like this. Short stride length, barely lifting your feet off the ground. Because in this discussion, when the brain can't use vision in the way that we're talking about, it does not trust itself being on one foot between steps. Right? Because some of you are going to have balance enough problems on 2 feet. Heaven forbid that you're between steps. Right? Because normally the knee comes up, the leg swings out, and in that moment it's like riding a unicycle. But if the brain can't use vision well enough, think about vision in this context as being 2 different gyroscopes, similar to the gyroscope in an airplane, right? There is nose down on an airplane, that's called pitch. Wing to wing, that's called roll. And head to tail, that's called yaw. And our head does the exact same thing. Pitch, roll, and yaw. Holy smokes. And think about the dynamic of, it's one thing when you're sitting still in a chair and have to use your eye movements. It's another one when you stand and put your whole body in an extension and use your eye movements. It's a whole different dynamic when you're sitting and turning your head and using your eye movements. And holy crow, it's a whole different thing when you're walking and turning your head and your eyes. That is a lot of high-level math that your brain has to compute literally in milliseconds. And if not, something's going to give. So in this context, and there's the idea of the brain using both eyes together as a team. Okay? The pencil to eye crossing, that's similar to a weightlifting term called the 1 rep max. Right? How much weight can you lift at one time? And even if you can lift, 300 pounds in a deadlift, you're going to quickly lose grip strength because it's hard to lift 300 pounds and keep your hand on the barbell with 300 pounds. And at some point, your arms are going to fatigue and the barbell is going to drop. So there is a fatigue component. And yes, we don't walk around and look at things this close to our face. But when I do this particular measurement, it's an immediate insight into how is your mirror neuron network working and how is your brain using your two eyes together as a team. And it takes 10 seconds to measure. But if you're practicing in the 2-circle model, nobody's ever doing this with you. And then it never becomes a talking point because you can't diagnose a condition if you never test for it. And then, on a related note, similar to weightlifting terms, there's something called an AMRAP. As many reps as possible in a unit of time. How many push-ups can you do in a minute? How many sit-ups can you do in a minute? You get the idea. Well, when I look far away and my eyes move out to parallel, and I look up close, and they're supposed to cross, and I look outside and they move far away, we do that on average, you ready for this? 50,000 to 100,000 times a day. So the question becomes, are you doing that quickly, easily, accurately, and sustainably all day? Because if you're not, your brain's going to tire out. Because we don't like seeing blurry and double. And in the discussion of binocular vision, that means both eyes have to work together as a yoked team, whether we look right, left, up, down, any on the diagonals, or in and out. And a classic example is you're looking down the freeway, speedometer, freeway, speedometer, freeway, speedometer, TV. TV, book that's on your lap, TV, the phone that's on your lap, across the dinner table, at your plate, all day long, 50,000 to 100,000 times a day. So, there's a couple of adaptations around this concept. One, because we have closely spaced eyes, we make an effort to use our two eyes together as a team. And again, fatiguingly, inaccurately, exhaustingly. So that's not a great way to get through the day. So the second adaptation is some brains learn how to turn one eye off. That's the fancy word for that is called suppression. Central suppression particularly, because we're talking about now the center part of vision, not the peripheral vision. And there's a fancier name called intermittent central suppression, where the brain turns one eye or the other off, but intermittently. With that in mind, these two are identical, so I'm going to start one on either end. And you're going to hold it up close to your eyes or your forehead, or your glasses if you're wearing them. And you're going to look in here. And the first thing I want to do is I send this around. It only take about 8 seconds to look, but I want to know if you see one black circle or two. So have a look and keep sending it. Over here, you're going to your right, so send it to your right. You've had too long of a look. Send it on. Take about 8 seconds. The first question is, do you see one black circle or two black circles? Keep sending it, because I wanted to get it around. So this is one little insight into a binocular vision piece, an intermittent central suppression piece, and, interestingly enough, something called inattentional blindness. And while we're waiting to get this the rest of the way around, I do want to tell you that I have a podcast called Move, Look, and Listen. Move, Look, and Listen. And you should find it and listen to it. And there is an episode about inattentional blindness. And the brief description today of inattentional blindness is when you're not expecting to see something, we frequently don't see it, even when it's sitting right in front of our face. And I'll give you an example. So, did you see one black circle or two? One. Okay. Inside that black circle, did you see any white lines? How about you?
One.
And did you see any white lines?
I saw some black things.
Okay, what about you?
Two.
One circle or two?
Two.
Okay. Did you see any white lines in either circle?
No.
Okay, what about you?
I'm getting scared because initially I saw two, then in focus.
Yep.
And then I saw kind of like a cross,
Uh-huh.
like a white.
Yep, what'd you see?
I saw the two black circles, but they were floating back and forth. So they were almost Venn diagram.
Yes. And any white lines?
And there was white, not all the way around, just like a.
Okay, what about you?
One.
One circle?
Yeah.
Any white lines?
White crosshairs.
White crosshairs. What about you?
Two.
Same? Same?
Just one. I mean, just two.
You saw two black circles. Any white lines in the circles? Okay, what about you?
No. Two went to one, and then I didn't pay attention for the white.
From the mouth of babes. I didn't pay attention.
That's just like,
Same answer.
Okay, what about you?
Two circles that got together with one, and the same thing, I didn't pay attention to the right.
Okay, what about you?
Two, they turned into one, and I don't remember past that.
Okay, what about you?
Meaning one with the white slash.
Sideways only.
It was a,
It was on the diagonal.
yeah.
Oh, that's even more messed up.
Kind of similar to everybody. Really hard to.
Okay, well, I'm going to do a quick walk around and show you the card first. So, there's two circles with a white line in each.
Yeah.
Two circles with a white line in each.
Yes.
I didn't even see the one.
But the brain's job is to put the circles together and make it be one black circle with a white plus sign. So, now that I've said that, this time the goal is one black circle, and this time look for one or more white lines. Quickly go around. Because the ultimate goal is to see one black circle with a white plus sign. And if either one of the lines, let's say that you see, this time that you see one circle and you see the vertical line only. If that was true, then your brain isn't paying attention through your left eye, because the left eye is supposed to be seeing the horizontal one. If you see horizontal only and vertical's not there, your brain's not paying attention through your right eye. If you see the plus sign, but the vertical stays and horizontal line is blinking on and off, that is left eye intermittent central suppression. Is that what you saw?
yeah.
Oh.
It was kind of there, and then it wasn't, and then it was there, and then it wasn't.
I'm going to come back to you because you're going to be perfect. Did you see?
Very similar. It was like this. I didn't see the line coming to the
Only
other
because
side.
he's talking about it. Though.
Got it?
Same thing.
Same?
You can see the
Well, I had
line.
a twin.
Was
I could only see.
so
He just had cataract surgery.
you saw something like that?
They closed the one eye.
Yeah,
but this kind of
came in.
The horizontal came in and out. Okay. How about you?
And then I
So
put it together.
They were more, how do I explain? They were a little bit, like, I felt like they were more like a line, like an act, like, before it was a little bit more off, like this, but now it's got more centered. But I do see, like, not solid completely.
The lines would take turns disappearing?
Not completely disappearing, but kind of like.
Yeah, partially fading in and out.
Yeah, or like parts of it.
Okay, so I'm gonna come back to you for a second.
Okay.
Tell me if you can get the one black circle again.
Yeah.
Okay, so in the one black circle, you see both lines, but horizontal comes and goes?
Yeah, and it's kind of altered. Sometimes it's just on one side of it, and then it's kind of growing a little bit. It's just the horizontal one's kind of moving all over the place.
Yes. And I'm telling you, so if we go back to my analogy about both eyes being two gyroscopes,
Yeah.
your right gyroscope is all locked in on vertical, and your left gyroscope is out of synchrony.
Okay.
Oh, but it gets really interesting now. Hold the stand in your right hand only, and all I want you to do is waggle your left fingertips when you look in there. And tell me if horizontal stays on better when you're waggling your fingertips.
It didn't have anything to do with this.
No. It's still kind of.
Hold this all the way up to your glasses. There you go. Does horizontal try to stay on more solid when you're waggling your fingers? Or it does not?
Yeah. It's just now the horizontal lines or the vertical lines kind of working.
Okay. Does horizontal stay on better when you're waggling?
It seems like it's fighting it to keep
Yeah.
really trying to get onto the other side.
It's trying to.
It's trying to.
Okay, both of you, when you look in there, this time I want you to. This time when you look, I want you to, instead of all this fidgety behavior, I want your fidgets to be eye blinking, fast eye blinking. And see if both lines try to stay on better, and if it tries to become a plus sign more when you're blinking fast.
Yeah, it's trying.
Yeah.
Trying harder. Yeah.
Yeah,
Yeah, I see both lines the whole time
when you're blinking fast.
when I'm blinking fast.
Because blinking fast basically does this to visual attention.
Because what? We could see
Wake
you were
up,
walking.
he was pushing him on the shoulder. He was saying, wake up, pay attention.
Yeah, it's like this. Blinking fast basically does this.
Okay.
It's like, would you wake up and pay attention? But so does fidgety behavior. And fidgety behavior can be bouncy legs, twiddly thumbs, fiddly fingers, stroke my hair, play with bracelets or rings, bite my lip or the inside of my cheek.
So next time you see people being fidgety, you'll know that it's the brain saying, I gotta stay awake.
The fidgetiness helps the brain turn both eyes on in a less effortful way. So let's go back. Does the brain use both eyes together well? Or does the brain use both eyes together but with a tremendous amount of effort? Or does the brain try to cope and adapt by suppressing one eye or the other? Or does the brain try to cope with trying to get both eyes on together better but less symptomatically by becoming fidgety? Or 5, you just avoid the situations that cause you to have a bunch of other symptoms. A classic example of that. Let's go back into the third circle. Now I'm going to introduce you to a concept, a visual pathway called a magnocellular visual pathway. And the magnocellular visual pathway, in lay terms, is related to motion processing. And motion processing is sometimes referred to as the where and the how pathway, different than the what pathway. So the what pathway is more connected to the parvocellular neurons in the visual system, and the what pathway is more conventionally in that first circle related to 20/20. Right, you've got the retina, which is specialized brain tissue pushed out into the eyeball. And then there's the optic nerve that you've heard of. There's the macula, which you might have heard of, right? And one of the common things, it's still uncommon, but one of the things that can happen as we age is that we develop macular degeneration.
Yeah.
And in the very center of the macula is an area called the fovea. And the fovea is like the pinhead on a needle. So when I'm asking you to read letters off my eye chart, what I'm really asking is, can you line up your fovea right on the eye chart? Because the fovea has the highest level of visual acuity in the retina. Right? So when I'm trying to get you to 20/20 or whatever, I'm trying to get you to line up your fovea. Well, we've got two foveas that are supposed to be in exact synchrony, no matter where we look. And in this discussion, anybody who's had a brain injury, let me back up. This isn't anybody that just has a brain injury. The difference between the way I practice and the small of us that still practice this way, because those of us that practice this way, my optometric colleagues started building on this whole discussion. This is not hyperbole when I tell you this, back in the 1920s. This is not new information. We've got better neuroscience information, better imaging that supports what my colleagues were talking about and doing in the 1920s and 30s when they started to put this all together. So for those of us that still practice this way, here's the difference. If you come to see someone like me, I presume that you have a third circle problem until you convince me that you don't. If you go to the two circle doctors, you're almost never going to find out you have a third circle problem because they're not looking. Which is really affecting anybody who's had a brain injury's totality of their quality of life. Because you have all these new symptoms that are not going away, and you're being told you see 20/20 and your eyes are healthy. It can't be your visual system.
Can I just have a show of hands? Have you personally, or have you heard of somebody say, the doctor told me I was 20/20, so I'm fine, and I know I still have problems? How many, show of hands, have heard this from somebody? So I just want you to know that we're supporting
Yes.
that.
Yeah. But I've also heard somebody say, and I didn't understand it, we had an exam in an office, and they said, I have done the prescription as best that I can outside of the third circle. I cannot do anything with the third circle in this office.
So an optometrist who admitted to not going further than 20/20.
Yeah.
Okay.
Well, that's both good and bad.
Yep.
Because here's somebody who's acknowledging a third circle problem and says effectively to you, too bad, so sad. I can't do anything. Well, yeah, no shit. Well, then why don't you send me to somebody who will?
Exactly. That's what we need.
Because they know this. They learned it in optometry school. In my mind, that is negligence. But nobody's getting taken to court over this kind of negligence, and they should be.
Well, and the interesting thing is, I have to go to my story because it was not this kind of optometrist that got me started. I was in Texas at Center for Neuro Skills with an OT that said, well, nobody's talked to you about this? Third circle. She didn't call it third circle at that time. This is 26 years ago. And she said, okay, so she's tried a bunch of lenses on. She put blue tint on me first. And I didn't know if there's anything else in there. All of a sudden, the entire room settled down. I didn't realize I had an anxiety problem until I realized that the room doesn't always do this.
Oh, wow.
So my anxiety, and then she told me to walk across the room, and I didn't stumble. I didn't look like I was drunk. So all of a sudden, the entire world opened up, and the next thing I knew, she was taking me to an optometrist's office who practiced like he does.
In Texas.
In Texas. So when I was coming back to California, I thought, this is going to be real expensive to go back to that eye doctor. And then somebody said, well, you don't know Doug Stephey. No, but I'm going to. And so now it's been years finding out that what he does is the same thing with the same emphasis, with the same patience, in explaining and answering our questions. So thus, he's here with us today.
So let's take a look at this. Well, I can't imagine that there's anybody in this room who have not noticed this drum sitting next to me,
I hate it.
right? You have a hard time looking at this.
I do.
I don't like it.
And it's right next to you, so it's like paying attention to you, being that close to you in my peripheral vision.
Yes, yes. And then I'm going to make it worse. But play along with me. And if it's super, super bad, then look when you need to, but otherwise don't look at it. But I'm going to come in the middle and then give you a quick overview. So some people that I have look at this, it's more detestable when I'm 5 feet away. For many, it's more detestable when I'm 8 to 10 feet away. Because the further away I get, perceptually, the stripes become thinner. And the thinness of the stripes, in some cases, is what's more irritating than the stripes themselves. But here's the question that you're thinking to yourselves. Number one, is this annoying to look at? I already know it is for you. But you're doing your own self-assessment. And notice, I'm watching you be bouncy over there. Because if you make an effort to not be bouncy, stop that left leg. And is this more irritating to look at when you're not bouncy?
Yes.
Remember one of the adaptations I talked about earlier? Learn how to be fidgety? Yes. Okay, so is it annoying, number one? Number two, do you feel it in your eyes, your head, your ears, your jaw, your throat, your chest, or even in your gut? Where do you feel it?
Oh my God, my anxiety's high right now.
Yeah, so look away because I don't want it to be high. You're being bouncy because you need to be, right? Okay, I have a new question. Let me get rid of it for a second. This time what I want all of you to do is to take a couple of, well, you know what, let's try to reset your nervous system. And the way we're going to do it is that I'm going to have you do this with both hands. Both hands. That's going to try to get you back to some sort of a baseline. Oh, look at you breathing over there.
That's what I did. Stop breathing.
Okay. And if you notice, this is what a lot of autistic kids do. They're regulating the nervous system for a third circle problem nobody knows they even have. Okay, so hands back down. So now I'm going to come back over and I'm going to go back to the middle of the room. Oh, take a couple of swallows now. Just do a couple of swallows to see what that feels like. Because my question is, when I come back over here, is it harder to swallow when you look at my stripes? I'm guessing for you it is harder to swallow. Is it harder for you?
It's not.
Not
it's
really.
Not bothering me.
Say that again?
I said it does bother me a little bit.
Yeah. And is it worse? You can imagine. Well, let me describe it first. Do you think it's going to be worse if I spin it?
Don't do that.
Let's find out. There's right to left, and there's left to right. And where people feel this can change left to right or right to left. But my new question for you is to look through that bottom pair of blue. And I'm going to have you look through this bottom blue and see if it's a different experience.
Wow. I was doubting before if the stripes were the same size. And they had fuzzy edges to them. And now I see more, although they kind of bend out, but yeah.
But wow.
Wow.
And it feels like you can breathe?
Yeah.
And swallow? And not have to be fidgety?
Yeah. Oh, wow.
How are you doing over there?
A lot better.
A lot better. And she's got a slightly darker blue than you have. So you know what? I'm going to have you guys trade out.
Okay.
And see what happens to either of you. You went from the darker blue to the lighter blue. You went from the lighter to the slightly darker. Does this feel even better to you?
Way better.
Way better.
Yeah, that one felt better.
That one's better.
Yeah.
Okay. And then what? Go ahead.
When I wasn't using it, the lines were like wavy.
Yes.
Yeah.
But as soon as I put it on, it calmed it down.
Everything straightens out.
Weird.
Well, here's another way. Take your left hand and cover your left eye. No, just your right eye. That's not as anxiety producing with one eye covered, is it?
No.
Oh,
What?
yeah, if I cover this one, no problem.
No problem.
This one, it's like I'm on an amusement park ride.
Yeah. So, let me put this in here so you don't have to look at it anymore. How crazy is this?
That's wild.
Oh, I got one more for you. And for you too, perhaps. My question is, no color, both eyes open. And I think you're going to feel this. I don't know if you will or not. But what I want to know is, in your mind, when I put this back up, does your mind want to almost immediately get fidgety?
Oh, yeah.
Is that true?
Yeah.
It is true, because I'm seeing it come out of your left leg.
No, I think it turned off.
Right.
Exactly.
Right.
Yeah.
Because, remember, one of the adaptations I talked about earlier was, if your brain's got both eyes working together poorly, one of the adaptations is learn how to shut one eye off. At the brain level. And remember when I went back around and had you look at the one black circle and you're like, hey, I see vertical pretty good and horizontal sliding all over the place and blinking on and off. That sliding, disappearing horizontal line was what your brain's supposed to see through your left eye. And it was not stable.
No.
So, and color can immediately, well, arguably, it did.
Mm-hmm.
Color can immediately change the entire nervous system. How many people in here are sound sensitive? Oof. Okay. So, this still has a lot of water in it. So it probably won't be as crinkly as it could if it was emptier. But I'm going to ask you, and you, but everybody else who's thinking the same thing. If I were to crunch this up in my hand, is that going to make your jaw get tight and your eyes get squinty?
Maybe, I don't know.
Let's find out.
Yeah.
Holy, you just felt, did you see that?
Both feet moved and her shoulders.
Her whole body flinched.
I went backwards.
Okay. Look through that, and now I'm going to bring it over to you in a
bottom?
second. The bottom one. That different? Check it out.
It's calmer.
See, my
Welcome to the third circle.
When Lee Chandler put those tinted lenses, and we hadn't even left Center for Neuro Skills, she put the tinted lenses on me, and I was a real person again. It was just the tint, it wasn't the prisms that followed.
Now, your furrowed brow wants an explanation.
Oh, yeah.
He's got questions.
So then here's what I have you understand. Vision, auditory, taste, touch, and smell, right? Classic five senses. If we could bundle up all of those sensory neurons feeding information to the brain and put them into one big fiber optic cable, there's about 3 million copper wires feeding information to the brain. Of the 3 million fibers, there's only 30,000 auditory neurons per ear. There's at least 1.2 million neurons in each eye. 2.4 of the 3 million sensory inputs are tied up in vision in the third circle. Why is that important in this discussion? Because we have a 24-hour endless loop tape where our subconscious mind is asking itself the question, do I feel safe? And during waking hours, by a factor of 60,000 neurons versus 2.4 million, by a factor of 60, we are answering that question, or supposed to be, through vision. So when our subconscious mind is asking itself the question, do I feel safe? We're supposed to be able to ask and answer that question below the level of conscious awareness through vision. And if the brain can't use vision fast enough or well enough, our subconscious mind starts freaking out. And then it thinks to itself, I'd rather be safe than sorry. So threat is imminent, because I can't answer the question that it's not, and I'd rather be safe than sorry. So when the subconscious mind, in a panicky, somewhat frantic way, wonders, well, am I safe or not? The subconscious mind defaults to the conscious mind. Well, how's the conscious mind going to render an opinion? It puts all of our sensory systems at DEFCON 1. We're motion sensitive, we're sound sensitive, we're taste, touch, and smell sensitive. We're everything sensitive. Because threat is imminent. Or so the brain thinks. And in that moment, I describe that as looking everywhere and seeing very little, and listening everywhere and hearing very little, because our sensory systems are now pushed into simply scanning the environment continuously and exhaustingly, because you can't be on high alert status all the time. It's going to burn out your adrenal glands. And you're going to be perpetually fatigued because you can never regroup and re-energize, because sleep can't be that solid either. Because the mind is never able to answer that question about feeling safe, and so it's perpetual. That is very dysregulating. And one of, just to introduce you to the idea of this, that one of the more common mineral deficiencies is magnesium. And when our stress is high, our magnesium levels plummet, because we're burning up magnesium as quadruple the rate that we normally would be using magnesium.
I'm sorry, what did you say about, can you start again with
Yeah.
magnesium?
So just to introduce you to one of the ideas of being minerally imbalanced, is that when our stress levels are higher, we burn our way through our magnesium stores much faster than we're not stressed.
So we're burning through magnesium faster.
Yes, and then you're going to be perpetually depleted in magnesium.
What if we're taking 800 milligrams of magnesium?
It may still not be enough.
Because the body might not absorb it.
No, that the body's burning through it.
Oh, wow.
So stress is up, magnesium is down.
Now, is it as simple as one mineral? No. No, and then we start to tilt into a whole different talk, but since we're on the topic of it, there's something called the AA to EPA ratio. It stands for arachidonic acid versus eicosapentaenoic acid. That's why it's a lot easier to say the AA to EPA ratio. Arachidonic acid is a pro-inflammatory hormone. Eicosapentaenoic acid is an anti-inflammatory hormone. That ratio is supposed to be 3-to-1, 2-to-1, or 1-to-1. The average American has a ratio of 20 to 25 to 1. Meaning that we have way more inflammation at a cellular level in our body than we should have. I don't know what the upper limit is, but now I'm going to go home and ask the people that probably will know this answer. I don't know what the upper limit is. But I can tell you that a number of years ago, I had a mom who was a teacher, self-diagnosed ADHD, and her 8 or 9-year-old diagnosed ADHD son from elsewhere. They did this brain span test kit. It's a dried blood spot kit I carry to my office. I charge $190 for it. It's a finger stick. You collect a couple drops of blood, send it into this lab in South Dakota. And one of the findings is this AA to EPA ratio. That mom and that kid had a ratio of 76-1. It's supposed to be 3-1 or better. Why am I telling you that? Because our cell membranes are made up of these fats. And the question becomes, do you have too much omega-6 fatty acids in your diet and not enough omega-3s? And omega-3s classically are from fatty fish, fish oil, cod liver oil, grass-fed beef, bison, venison. Grass-fed has higher levels of omega-3s, not as much from my recollection as fish oil or cod liver oil or fatty fish in general. But my point is that anybody who's had a brain injury needs to be taking omega-3 fatty acids, whether it's 3 hours after a brain injury or 25 years later. And everyone should know this ratio. And there's a podcast episode with a retired military doctor named Michael Lewis. He wrote a book called When Brains Collide. He's a guest on my podcast, I think late in season 2 or early in season 3. When Brains Collide. And yeah, so we should be getting enough omega-3 fatty acids in our diet. And the reason that's relevant in the mineral discussion is because I suppose to some degree, to oversimplify, you could be eating a perfectly clean diet and getting a lot of good nutrients in your body, with the exception if your AA to EPA ratio is too high, because then those nutrients can't get across cell membranes into your cells, and the metabolic waste that's created inside your cells can't easily get out through the cell membranes to then be peed out, pooped out, sweated out, or breathed out.
So that's a metabolic blood test, right?
Yes.
Okay, because somebody wants me to get one, and I was like, what is that? So that's a metabolic blood test.
So that means toxins are staying in your system?
Say that again?
That means toxins are staying in your system? Or
Yes. The simple answer is yes.
Okay.
Which then drives up further inflammation. And then we're not really going to have a talk today about copper and iron, but that is a big deal too. In fact, there's a theory of aging that is connected to how much iron do we accumulate in our body over our lifetimes. But I'm getting too far afield from...
Well, we're not going to keep him for a week. There are more topics to come. And also, Chris has a lot of this as well, because when I get those two in the office together, it's a whole nother day in discussion. But so yeah, I'm taking notes for more discussions. Chris has one coming up next month here on something connected to some of this as well.
Don't turn this over yet. Pass this around.
But yeah, let's get back on topic for Dr. Stephey.
Could I just mention one thing, that I have to have
Hold on.
I have to have my fish and avocados every week, and if I go too long without that, I'm off.
Well, and the thing is, feel your body. Every doctor I've seen for the last 26 years has always said, Celeste, you listen to your body. If you're not listening to your body, you're not doing your what you should be doing. So number one, if you're not, come next month, we're going to explain what that means. And the other thing, you wanted me to remind you about transitional lenses.
Yes.
And
I need to stop in how many more minutes? Like 2 minutes ago?
yeah, probably. It's 11:03.
Okay. Can I go for maybe 10?
Oh, as long as you want.
Okay.
We'll keep you a week. I mean,
Yeah.
I just have all the
Okay. So I only made 10 copies, so when you turn it over, you'll have don't turn it over yet, but you'll turn it over in a minute and have a look, and send a couple more copies over that way. But on the opposite side of this piece of paper is a different black and white striped grid that could be equally or more irritating than the optokinetic drum itself. So when you turn it over in a minute, there's a black spot in the middle that's where you're supposed to look and keep looking there and just be aware of the whole pattern of stripes. And if it's super annoying, then look away or close your eyes. If you can somewhat tolerate it, take a moment about where do you feel it? Is it in your eyes? Is it in your head, ears, jaw, throat, chest, or gut? Close one eye. See if it's a less irritating. Maybe get bouncy. See if it's less irritating. Yeah, let's talk our way through that. So everybody, if you got a piece of paper, turn it over. If it's super annoying, then turn it back over and pass it on to somebody else. Don't look at it. But you might find it somewhat annoying. And the lines might wiggle, move, vibrate, pulsate. You might see colors in the pattern. You might see shapes that sort of morph in and out within the pattern itself. But just generally, it might not feel all that great. It won't necessarily feel bad if, when you have both eyes open, if your brain has successfully turned one eye off, because then you've turned yourself into a cyclops. And this is probably 90 times out of 100 better when the brain turns one eye off, or if you cover one eye. But here's my main point. When you read, if you get sleepy and tired and bored and lose attention and lose your place and can't remember what you read, it's tied into this pattern. Because print is black and white stripes. Yes, there's words and language comprehension, but strip all that away, it's black and white stripes, which can be ridiculously fatiguing. Which then leads me to this discussion. So there's 4 big items that brains that have eyes that don't work together very well or see slowly through magnocellular cellular dysfunction. Black and white stripes, or patterns in general, even this floor with the patterns in the floor can be irritating for many people. Or bright sunlight and glare, because bright sunlight, because it's such a powerful stimulus, if you've got your brain turning one eye off and you don't even know that that's happening, bright sunlight is going to force you to turn both eyes on in a dysregulating way. So does flicker. Whether these one of the bulbs, even if one of these bulbs doesn't flicker, if your brain is in a hyper excitable state, these lights will bother you even when one of the bulbs doesn't actively flicker. They're just annoying. And they're less annoying if you've got prism or color in a pair of glasses, or if you need vision training to get your eyes to see faster and work better together. And the 4th thing that really bothers a lot of people is movement in the periphery. Classically, in the carpool lane. If that really bothers you, there's some people who won't drive the freeway anymore because they can't handle the speed of what's happening in freeway speeds. There's too much information that's happening, and it's overwhelming to the nervous system, and you don't feel safe. Or if you drive in the carpool lane and you have this, and this movement bothers you, heaven forbid you tell anybody this because they think you're crazy and they'll send the straitjacket for you. But some people that drive into the carpool lane but are really bothered by this movement, there's going to be times where your hands are on the wheel and the car's going to feel like it's been demonized and wants to drive itself into the wall. Because that movement is like a tractor beam on attention. And when movement over here is grabbing your eyes want to look that way, your whole head wants to turn that way, and your hands want to do this. And then you're going to white knuckle to keep the car straight and try to ignore that movement. And even if you're not the driver, there's a really good chance that you're going to be an easily startled or jumpy front seat passenger in the car because you're not using both eyes together quickly and accurately, and you can't judge time and space, and your autonomic nervous system becomes dysregulated, and you get flinchy like you did with the black and white stripes. Okay, I'm going to take a breath. We got to still talk about that card. But before I do that, I also want to talk about this briefly. So if you're old enough that you need one prescription for distance and a different one for reading, right? Classically, that's going to be in a bifocal with a line or a bifocal without any line like I'm wearing. But even though you might need 2 different prescriptions, having a bifocal with a line or a progressive like mine can really affect your mobility and your balance. Because there's a lot of movement and swimming down here. And someone who has motion processing issues and binocular vision problems, that could really amp things up. And that group is really better off to have either 1 pair for walking and looking at distance and 1 pair for reading and computer. Or if they've already got an existing bifocal or progressive, they might keep that when they're seated and looking, let's say, the TV and reading, but not motor around and walking. And they might need a single vision distance pair to improve their mobility. And frequently, the changes are immediate when you're in a single vision pair. Okay, so now let's go to this. So the first thing I would tell you is you should hold the card on the horizontal axis so the words are to the left. So you want to hold it like this. You want to hold it like that where the words are to the left. Okay? All right. So now we're talking about pattern recognition. And what's really interesting is that once you see this, you won't be able to unsee it. But the challenge is to see it to start with. So, and it is kind of interesting to see what stories people will make up. Like Chris sees waffles.
Now I see a forest.
Now you see
Like a forest on
a
the right.
forest.
Cow.
Okay.
I read turtle.
We got a turtle, we got a cat, we got a cow.
I saw a cat.
Any other takers what you see?
Bird.
We got a bird over here. Okay, so now what I'm going to do is that I'm going to re-emphasize what she reported, and now I want you to think cow. Yeah, you see.
But I saw the cow when I had it up here. Up here, I can't see that at all. But
Well,
like
would you? Are those glasses for driving or for reading?
reading.
Yeah, so put them on and see if you can see it closer, more easily. Than
Is it a cow?
It is a cow.
Oh, I still don't see it.
I know. Some of you won't yet.
Yeah.
Okay, so
I don't see a cow.
So what about, I'm going to take a moment to walk around, and I've highlighted the cow's face, and see if you can get it organized to see it when I've highlighted it. Do you see it now? Yeah. Do you see it when I've outlined?
Yeah.
Right, there's its snout, there's its face, there's an eye, there's an eye, there's an ear, there's an ear.
Now I see it.
Right? You see it now? You see it, right?
I only see it because you showed me that. Yeah, I can see it now. Yeah. But if I didn't see that, I won't make it out.
Right?
I didn't. I
Yeah.
see it now here. Can you see it now here?
Yeah, now.
Yeah.
Only because
Yeah.
But if you-
Now you got it organized.
if you didn't show me that, I would be like, no, I don't see the cow.
You see where I've got it outlined in pink?
Oh my God, okay, I see it.
Yeah, now I see it. I did not see
Okay,
that.
I
I
know.
didn't see that at all.
Wow.
My first glasses were dark blue.
Yeah.
And then I used those like,
There's the ears, the eyes, the
This is the
snout.
nose
but then I
part.
forced
This
myself.
is
Right,
the ear.
but
the
once
ear,
I
but
outlined it,
the eye,
now you
the
see
eye,
it.
and then It's like.
But I'm
Okay.
in a second.
That's all I have.
Good to help.
But alone.
We-
You see it on my?
Yeah, we were going to some place.
So how wild is that?
Very.
And once you see it outlined in the card, if you didn't see it originally, but now you see it like this, you can't unsee it again.
Yeah,
Yeah.
you're right.
Yeah.
Absolutely.
That goes into pattern recognition, and we do pattern recognition all day, every day. But you might do it, well, then everything goes back to, are you doing it quickly, easily, effortlessly and sustainably, or slowly, inaccurately, exhaustingly, and not for more than 5 minutes at a time.
Is there, I'm sorry, is there a reason, like if something pleasurable, like I like Yoda. I love looking at Yoda for some reason.
Well, I think the question is, the question was, we were talking about pattern recognition, and arguably, we try to organize the world around us with things that we have preferences for. So when you say, I don't know why I like looking at Yoda, then I can make the argument that a lot of how you go through the day, you might put things together in a Star Wars themed mindset, just because that is something that's active in your mind.
Well, yeah, it's funny that you said that, because now I'm looking at the donkey over there like Yoda. I'm looking at the map up there and seeing Yoda. I'm even seeing the Yoda in the clock with the arms of the clock are reaching out.
Easily suggested.
Yes.
Yeah, it's right. It's really, the whole thing's really fascinating. So now I want to tell you so as we close out the day, then I want to tell you something practical. So if what I've said resonates with you, and if I'm within striking distance, you should come and see me for a regular exam. And my regular exam includes things in the third circle. And honestly, my sole purpose on a first visit with me is, can I immediately improve your quality of life with a pair of glasses with prism and color? And we'll know it. And many of you today experience a difference in the stripes and even in the sound. And the same thing is true with breathing. The same thing would be true with touch. Glasses like this can loosen a tight jaw or tight neck and shoulders and give you more cervical spine mobility. It can improve it can improve quad strength standing and sitting. It can improve stride length and balance when walking. In some cases, it can improve grip strength. It's just wild. But that's what I'm going to do on a first visit. Would I like anybody that has needs in the third circle, do I think that they deserve to be fully assessed? Yes, it's foolish to say anything but that. But if you've not had an assessment like that, you haven't been fully assessed, and you haven't made the recovery that you could have, because how can you when 2.4 of your 3 million sensory motor neurons haven't even been looked at? And then this is the practical reality. So this information, more or less, is summarily denied by most commercial medical plans. I'm still trying to find my way with getting the assessments covered. I would tell you that I haven't had 100% success at figuring that out, but step one is doing this almost 2-hour assessment that I normally charge $1,200 to $1,500 for, because it includes the 2 hours and it includes a written report that then talks about what should this therapy plan look like. Here's one of my great frustrations. Anybody that's had a brain injury who's been disabled and permanently disabled and out of work for more than 26 months, you're now eligible for Medicare. People are not figuring that out and not getting eligible for Medicare for reasons I can't fully still understand. But Medicare pays for vision therapy. Let me say that again. Original Medicare pays for vision therapy, which means that anybody who's of age and has Medicare, or disabled and become eligible for Medicare, if you have a Medicare Advantage plan, those Advantage plans, I believe every 12 months has to sign an affidavit with the federal government that says we will not treat our Medicare Advantage patients differently than if they had original Medicare. I'm telling you, if you have Medicare and you haven't seen someone like me, you are being treated differently. And you shouldn't be, because that's illegal otherwise. So I've gotten better at writing a network deficiency argument. I'll take somebody recently who's been in my office. They have Kaiser Medicare. Okay? She saw me about a year ago. I gave her color and prism and a pair of glasses. Her vertigo is 95% better. She was seeing a vestibular PT for a while, and I think that she's maybe seen OT, she's seen a neurologist. I don't know who, but let's just go with that. And has been seeing folks at Kaiser in this manner for a year or two. And finally, her vestibular PT said, you know what, I think this could be a vision problem. Now, why somebody's not getting that on the front end, I still don't know. But I'm going to give her some kudos that she told this patient that. She came to see me for the first time about a year ago. Her vertigo's 95% better. She recently told her neurologist this, who then argued with her that the neurologist didn't believe in prism glasses and that she couldn't possibly be better because this was still a vestibular or an inner ear problem, not a vision problem. What did I say earlier? You can't diagnose someone with a condition if you don't test for it. And here this patient is going in and telling her neurologist that she's 90 to 95% better with these glasses, and her neurologist is arguing with her. Look, I think if you had any inkling at all about wanting your patient to be better, instead of arguing with her about this, she would be like, well, who gave you those glasses and what's their number? Because I need to call them up and learn from them.
Yeah.
No, that is not how this is going. And I think that this gal is so fired up that when I told her, like, I'm putting this document together for you to go ask for an exception to be able to go outside Kaiser's network and come and see me, and they have to pay for it. I think she's fired up that she might be the first of my Kaiser patients that is willing to fight this fight. And I've got a similar patient who's got Kaiser, but she's got a commercial plan. Well, when she came to see me recently and I've given her new glasses, and that's all I've done, her migraines, her daily migraines are down by 90%. Her TMJ is down by 70%. She's quite excited because on a practical basis, she said, I can now pull on a pair of pants one leg at a time and not fall over on my bed.
Oh, really?
Yeah.
And I'm writing a similar letter on her behalf to Kaiser, but it's early days, and I don't know. Kaiser would be a giant juggernaut to bring to its knees. I don't know if we're going to have success, but there's several different steps along the way after the original denial. And I'm trying to fight the good fight, but then there's this. This will be the closing thought of the day. And I'm telling you that I'm setting you up, just so you know. So the question, well, I'm going to ask him. You'll think of your answer, and then I'll just give it to you. But the question is, what is the purpose of health insurance? You're going to think about that for a minute. What is the purpose of health insurance?
Well, we talk about it all the time. Hopefully for the patient, take care of the patients.
Yeah, no, that's not the purpose.
No, not at all.
The purpose is to squeeze as much profit as possible for the shareholders.
Yeah.
And it's not just peculiar to medical insurance. It's property insurance, it's your car insurance. It's like, we want to collect premiums. We just don't want to pay anything out. Because you cost me money when I have to pay out. So the medical plans, the medical insurers, will typically look at what we're talking about and say, they'll pull out the big red denial stamp, and they'll say, we consider this investigational, experimental, or educational. We don't pay for those things. Then there are appeal rights, which I think recently, I don't remember if I've had anybody recently try to take on their commercial plan, HMO, or even PPO, and when? I don't think anybody's taken it on recently, but
We're taking it on right now with Cedar Sinai. We just had a meeting yesterday with the director of Cedar Sinai.
over
Pardon?
what?
Over, referrals, over not being able to see certain specialists, or if they give me a specialist, they're dead. So then I have to go through the same, thing, and then they give me another specialist and they don't take my insurance, so then I go through the same, and I need specialists, like neuro specialists.
So who's your medical plan with?
Prospect, LA Care, Prospect Medical,
Prospect Medical is your medical group,
LA Care.
but LA Care is your insurance.
Yeah.
Right. Well, if you ever come to see me, I'm happy to document what I can and
Awesome,
write something on your behalf.
awesome.
Whether we have success or not is a whole different discussion. But
We're already at that, we're 2 years in, so
Right.
we're finally at that level where it's like, they'll look at anything right now.
Well,
But
then-
I've
then-
seen them deny, and then we went through the denial process, and
Yes.
then we went, we've been through,
Yeah.
we're at the top now.
okay.
Through multiple specialists. The lady actually was on a non-recorded line and told her, I can't believe how proactive you are. You're more proactive than most people. You actually are figuring things out. And she said, well, what do most people do in my case? And the lady, this is not an exaggeration, she said, well, they either die or they give up.
Right.
Exactly.
Oh,
Well, we said,
On speakerphone, that's literally,
Well, that's what they
hand
want.
to God, that's exactly what the lady said. Because she was on a non-recorded line.
Right.
well, and that's kind of amazing, because we talk about that all the time, and that's the two conclusions we've come at over and over and over again. They're waiting for you to die.
That's what they
And then
want.
I just take
We want to close this out, okay?
Yeah, we'll close it out.
Okay, so,
Gets me the type of
okay,
insurance
this,
1 year.
wait a
and
minute,
then I
guys,
go
this
to
is a
school
conversation
back,
that can go on for the next 3 hours, and we've got a group coming in next door, so we're gonna close it out. Come next month, we're gonna talk more about the nutrition side of the things he started on, and a lot of the others, and now we're gonna make a commitment on tape and in front of witnesses that you're coming back.
Yes.
So we'll figure that out, whether it's June, July, or August.
Yep.
Huh?
I have something to say about that man right there. He is wonderful. When we used to meet, remember over at
On San Jose, yeah.
yeah, he came in, and does Danny come?
Yeah, Danny, a lot of you have met Danny, and when he came to Dr. Stephey's office, he would walk like a duck. We always said that for
Walks
balance
like a duck.
purposes, he held his arms out, or he would be touching the wall going down the hallway. And his mom, I think, was in the office with him, and his dad was on the phone, and he had them both in tears. That Danny put the glasses on that he gave him, and he walked without touching.
Yeah.
And so it was absolutely one of those most amazing things. There's another one I'll tell on a gal that he put a blue line down the floor, and she'd been mugged, so she didn't like anybody near her. I mean, this across the room was too close, and he put her across the room, and he said, take a step towards me, and until you're not comfortable. And she said, I'm fine right here across the room. And then he put the glasses on her, and her folks were to the side. She walked all the way across the room and stood in front of him like we are right now. And her parents were in tears. They hadn't seen her be able to be with people or even make that kind of approach to a person. So and I could go on with testimonials. You want to stay a week? So the idea is that we have testimonials. We have a lot of it on tape. We have a lot of it where people are telling stories like Jan was just expressing about Danny. People that we begin to understand, and the hair goes up on your arm, the tears start, and we do know that this third circle he's talking about now, this idea that those that are aware of what's going on, we want more professionals, as you guys are talking about, to be able to talk about it and to get it in, as I say, what we talk about in this room and on Zoom is not news flash. It should be common sense, and everybody should know about it. So we're going to keep doing this on Zoom and in this room. So I thank you all for being here, and we're going to shut down the audio now, and then I have a couple comments.
Okay, just say one important thing. Please keep coming, because this is what we're learning how to get better, and this is where we get the information to get better, because we're not getting it we're not getting it from the optometrist, we're not getting it from our neurologist, we're not getting it from the medical world. This is where this is where I'm 8 years coming into right now. And I wouldn't be in my state today the way I am if I wouldn't have gotten all the information that helps. So this is where we learn to get better. So
Okay.
please keep
Let
coming.
me say too, if you're going to the neurologist, you're going to your family doctor, they take you so far as they are educated. We love them, we appreciate them, they do for us what we need them to do. But that's as far as they're trained. So we're not gonna take anything away from them. We need them, we love them, we're gonna keep going to them. But we definitely understand that all we ask of them is to send them to the support group, send them to the next step. And that's what he was talking about too. They should at least know where to send after their knowledge and experience is done. Okay, so love y'all. See you next month.
Thank you.